Imagine a disease that just, well, strikes with little or no warning, often leading to sudden death. Leaves absolutely no time for intervention.
Yeah, it's not just a nightmare scenario for farmers. It's the reality of um, a whole group of diseases threatening cattle globally.
And when we talk about silent killers, it's more than just the suddenness, isn't it?
Absolutely. It's the mechanism itself. The way these toxins work, they often bind irreversibly.
Yeah.
So by the time you even suspect something's wrong,
It's already too late. The damage is done.
precisely, which forces a totally different approach to animal health. Proactive foresight isn't just, a good idea. It's essential for survival.
And that's exactly what we're unpacking today. We're taking a deep dive into clostridial diseases in cattle.
Right. A devastating collection of often fatal conditions caused by this really fascinating but dangerous group of bacteria called Clostridium species.
What makes them so unique?
Well, a few things. They're gram-positive. They form these incredibly tough spores. And crucially, they're strictly anaerobic.
Meaning they thrive without oxygen.
Yeah.
Exactly. In low oxygen environments. And here's the ticker. They're ubiquitous, found literally everywhere. Soil, dust, even in the guts of perfectly healthy animals.
So our mission today is to really shed light on why these diseases are such a huge challenge, for farmers, for vets,
Yeah, how they work their magic, what signs to look for, if there are any signs at all.
and most importantly, how we can actually protect against them. We'll look at the three main types, right? The ones hitting the nervous system,
Mm-hmm.
the neurotoxic ones,
Mhm.
then those that destroy tissues, the histotoxic group.
And finally, the ones causing chaos in the gut, the enterotoxic clostridiosis.
So if you're someone wanting to understand these silent threats in agriculture, or just curious how tiny organisms cause such massive problems, this deep dive is definitely for you.
Okay, so we're talking about these Clostridium bacteria being everywhere. It seems a bit counterintuitive, doesn't it? That something so dangerous just exists dormant all around us.
It does. And I think the biggest misconception is underestimating just how resilient these spores are. People hear bacteria, but these spores, they're built differently.
How tough are we talking?
Incredibly tough. Found in soil, feces, like I said, even inside healthy animals. They can withstand high heat, drying out desiccation, and many chemical disinfectants too.
Wow, so they can just hang around in the environment
For years, literally years,
Right.
just waiting, a constant latent threat.
So they're lurking, dormant. How do they switch from being, inert to deadly? What's the trigger inside an animal?
Right, that's the pathogenesis, the disease process. Usually it starts when spores get ingested or maybe contaminate a wound.
Okay.
But the key is that anaerobic environment,
Mm.
low oxygen. That's their signal.
Like in damaged tissue from a wound.
Exactly. Or necrotic areas, even just the normal low oxygen parts of the gut.
Mm.
Under those specific conditions, the dormant spores germinate. They wake up,
And then,
then they multiply fast
yeah.
and start pumping out these incredibly potent exotoxins.
Ah, the toxin. That's the real weapon.
That's the primary cause of the disease, yeah. Local tissue damage, gas formation, systemic effects like toxemia, muscle paralysis, shock. It's devastating.
You mentioned potent toxins. Do they all work the same way? Or are there different sort of attack strategies?
Good question. There are different pathways. Take botulism, for instance. That's usually caused by ingesting preformed toxin. The toxin is already there in contaminated feed or water.
So the animal eats the toxin itself, not necessarily the live bacteria.
Right, whereas something like tetanus or blackleg, that involves the bacteria getting established inside the animal in a wound, or muscle then producing the toxins right there.
And these toxins are seriously potent.
Some of the most potent known to science. The neurotoxins from Clostridium botulinum, that's botulism, and Clostridium tetani, tetanus, are just unbelievably powerful. Tiny amounts can be lethal.
You hear that term silent killers associated with these diseases. It sounds incredibly tough for producers. What's the biggest implication of that silent nature?
It really underscores a critical, devastating feature. Many of these diseases have a rapid, what we call a peracute course. Often, sudden death is the first sign.
So minimal or no warning at all?
Exactly. And the implication for you, the listener, is that by the time an animal actually shows symptoms, if it even does, the damage from those toxins is often irreversible.
Meaning treatment is often pointless.
Frequently, yes. It makes prevention absolutely paramount. And it makes diagnosis in the field incredibly difficult, too.
And I guess it means the official numbers, the incidence rates, might be lower than reality.
Very likely underestimated, yeah. Many sudden unexplained deaths might just be written off, never actually confirmed as clostridial disease. It's like trying to solve a mystery when the main clues vanish instantly.
That's a sobering reality. Okay, we've got the resilience of the spores, the challenge of their silent attack. Let's get into the specific damage they cause, starting with how they target the nervous system. First up, tetanus. Clostridium tetani. Where does this one usually start?
Tetanus usually gets a foothold when spores enter deep wounds. Think puncture wounds, maybe surgical sites like castration or dehorning.
Or even issues around calving.
Right. Retained placentas,
Yeah.
umbilical infections, anywhere there's damaged tissue, and crucially, those low oxygen anaerobic conditions. That's where the bacteria germinate and produce tenospasmin.
Tetanospasmin, the neurotoxin. And how does that toxin then affect the animal physically? What are we looking at?
So this toxin travels to the central nervous system, and its key action is blocking inhibitory neurotransmitters.
Meaning the stop signals from muscles don't work?
Exactly. You get unopposed excitatory signals, continuous muscle contraction. That's spastic paralysis.
How quickly does this happen?
The incubation period varies a lot. Days, sometimes over 4 weeks, depending on the wound. But the signs are pretty distinct once they start. Generalized stiffness, reluctance to move.
Muscle tremors.
Yep, often noticeable in the face and ears first. That prolapsed third eyelid is a classic sign too. Lockjaw trismus, difficulty opening the mouth.
And that characteristic stance.
The sawhorse stance, yeah. Arched back, legs stiffly extended. The tail might be held out stiffly too, like a pump handle.
And the animal's behavior.
Anxious, hyperirritable, easily startled. Bloat is common too because the rumen muscles can get paralyzed. Ultimately, respiratory paralysis leads to death.
And mortality is high, especially in younger animals.
Tragically high in calves, often over 80%.
Given how fast and severe it is, how do you even diagnose it in a live animal if lab tests aren't definitive? And treatment sounds like a real uphill battle.
Diagnosis is mostly clinical, based on those striking signs, plus a history of a recent wound or procedure. You're right, no definitive lab tests for live animals.
Right.
And treatment. It's often unrewarding.
Why is that?
Because the toxin binds irreversibly to the nerve endings, and it does it early on. Tetanus antitoxin can help, but only if given very early to neutralize toxin that hasn't bound yet. It can't reverse existing damage.
So supportive care is the main approach.
Pretty much. Sedatives, muscle relaxants to manage the spasms, cleaning the wound, high-dose penicillin. But you're mostly just managing symptoms, hoping the animal can pull through.
Which means prevention is absolutely critical. What's the shield against tetanus look like?
Vaccination is number one, highly recommended, especially before surgical procedures. The tetanus toxoid vaccine, usually 2 doses, 3 6 weeks apart, then annual boosters, gives good, long-lasting immunity.
What about unvaccinated animals facing immediate risk, like surgery?
That's where tetanus antitoxin comes in. It gives immediate but temporary passive immunity, lasts maybe 7 to 21 days, enough to cover that high-risk period.
And basic hygiene.
Crucial, meticulous hygiene during surgery, during calving.
Yeah.
And prompt, proper care for any wound, especially those deep punctures.
Okay, next in the neurotoxic group is botulism. Clostridium botulinum. This one works differently, right? Flaccid paralysis, not spastic.
Exactly. Botulism is caused by ingesting preformed botulinum neurotoxin. Instead of blocking inhibitory signals like tetanus toxin, this one blocks the release of acetylcholine at the neuromuscular junction.
Acetylcholine. That's the signal for muscles to contract.
Correct. So if it's blocked, you get muscle weakness or flaccid paralysis, progressive weakness, not rigidity.
And how do animals typically get exposed to this preformed toxin? It's not usually a wound infection.
No, usually not. It's typically ingestion. Contaminated feed or water is the most common route.
Like what kind of contamination?
Things like rotting animal carcasses, snakes, possums, rodents, accidentally baled into hay or mixed into silage. Sometimes even poorly handled chicken litter used as fertilizer.
Yikes.
Yeah. There's also a less common form, toxico-infectious botulism, where the bacteria do grow and produce toxin in the gut. But ingestion of preformed toxin is the main story.
So what are the key signs to look for with botulism?
Progressive muscle weakness is the big one. Difficulty chewing, swallowing, you might see drooling, the tongue might seem limp. A staggering gait, what they call staggers.
And eventually they go down.
Yes, unable to rise. Sometimes they adopt this sort of frog-legged posture. And critically, unlike many infections, there's usually no fever with botulism.
No fever. That's a key diagnostic clue.
Absolutely. It eventually progresses to respiratory paralysis and death. And tragically, in a herd situation, losses can continue for up to 17 days after the initial exposure as animals absorb the toxin at different rates.
Diagnosis sounds really tough then. If there's no fever, no specific lesions on necropsy, how do vets pin it down?
It relies heavily on those clinical signs, the progressive flaccid paralysis, lack of fever, combined with a really thorough history, trying to find that potential source of exposure.
But lab confirmation is tricky.
Very tricky. And you're right, no specific gross lesions at necropsy shout botulism. Plus, the toxin is so potent, detecting it in feed or water samples is technically challenging. Vets often rely on the pattern. Multiple animals affected, no fever, no response to standard treatments. It's detective work.
And treatment options limited.
Primarily supportive care. Specific antitoxins for animal use aren't widely available, unfortunately, and antibiotics. They're not indicated because it's the toxin, not an active infection, causing the signs.
So humane euthanasia might be the only option in severe cases.
Sadly, yes, to prevent prolonged suffering.
Which just hammers home the need for prevention. What are the absolute must-dos for botulism prevention?
Vaccination is primary. Using the appropriate bivalent vaccine. Immunity takes about 4 to 5 weeks to fully develop, so planning is key. Revaccinating during an outbreak might help protect animals not yet showing signs.
And managing the feed source.
Crucial. Strict feed quality control. That means rigorous vermin control around feed storage, proper silage making to avoid any putrefaction, and obviously avoiding any spoiled feed.
What about things like poultry litter?
Yeah, in some places, feeding poultry litter or any animal matter to ruminants is actually illegal because of this botulism risk.
And carcass management?
Essential. Prevent cattle access to any carcasses, dispose of them properly, deep burial, burning, or at least fencing them off securely.
Anything else?
Nutritional management helps too. Correcting phosphorus deficiencies can stop animals from chewing bones, osteophagia, which is another way they can sometimes ingest toxin if those bones came from an animal that died of botulism.
Right, that makes sense. Okay, the neurotoxic diseases are truly frightening, attacking the control system. But what about those that cause direct, rapid tissue destruction? That takes us to the histotoxic clostridiosis. And the big one here is blackleg, Clostridium chauvoi. How does this one get started?
Blackleg usually starts when spores are ingested from contaminated pasture. They get into the bloodstream, travel to muscles, and just sit there, dormant.
Waiting for a trigger.
Exactly. The trigger is usually some kind of muscle damage or bruising, maybe creating a low oxygen environment locally. This could be from transport, rough handling, even just vigorous exercise in young, fast-growing animals.
So it's not necessarily a wound.
Not usually an external wound, no. It's more internal muscle trauma. Once triggered, the bacteria multiply rapidly, produce toxins.
And that causes the tissue damage.
Severe local tissue necrosis, tissue death hemorrhage, and that characteristic gas formation within the muscle. The toxins can also hit the heart muscle hard, leading to shock pretty quickly.
Which animals are most at risk for blackleg?
It typically hits rapidly growing cattle, usually between 6 months and 2 years old.
Oh.
Often the ones in the best body condition, ironically. And importantly, it's not contagious animal to animal.
What are the signs? Is it another sudden death situation?
Often, yes. Sudden death with no prior signs is very common. If you do see signs, it's usually acute lameness, depression, high fever.
And the characteristic swelling.
That's the hallmark. Painful swellings in the large muscles, shoulder, hip, back, legs. Initially, they might feel soft, but quickly become firm, doughy, and crepitant.
Crepitant. That's the crackling sound.
Yes, from the gas trapped in the muscle tissue. You can feel it, sometimes even hear it. The swelling also often has this distinct rancid odor, sometimes described like sour butter.
And it progresses fast.
Incredibly fast. Death usually follows within 12 to 48 hours.
How's diagnosis confirmed? Necropsy.
Diagnosis is often presumptive based on those signs and the rapid postmortem bloating that's common. Necropsy, C. You find that dark, red to black, dry, spongy muscle filled with gas bubbles and that rancid smell. The heart muscle is almost always affected too.
Lab tests.
Lab confirmation uses fluorescent antibody, or FA, staining on a smear from the affected tissue to identify C. chauvoi.
And treatment. Likely too late.
Rarely successful because it moves so fast. You can try high doses of penicillin very early, but the prognosis is generally very poor.
So prevention is everything with blackleg. What's the strategy?
Vaccination is the cornerstone. It's highly effective. Killed bacterin vaccines, usually the multivalent ones like 7-way or 8-way that cover multiple clostridial diseases, are safe and reliable.
What's the typical vaccine schedule?
Usually 2 doses, 4 to 6 weeks apart, starting when calves are maybe 2-3 months old, with a booster at 4-6 months, then annual boosters. Timing the booster before calving is good practice too for maternal antibody transfer via colostrum.
And managing the environment, since the spores last so long.
Absolutely. Proper carcass disposal burning or deep burial is vital to stop spores from contaminating pastures for years to come.
Okay, moving on to malignant edema. Primarily Clostridium septicum, but others can be involved. How does this one differ from blackleg and how it starts?
Malignant edema is typically a wound infection. Spores get in through lacerations, punctures, surgical sites, injection sites, even difficult births.
So an external entry point is more common here.
Yes. Once inside, the bacteria produce toxins causing severe tissue necrosis, a lot of inflammation and edema that's fluid swelling and often some gas, plus rapid systemic toxemia.
What are the signs? How quick is the onset?
Signs develop fast, usually 6 to 48 hours after the injury. You see loss of appetite, high fever. Locally, you get these soft, painful swellings that pit when you press them, and they spread rapidly.
What does the affected tissue look like?
The muscle underneath is often dark brown to black. Gas can be present, but usually less pronounced than in blackleg. Death is, again, rapid.
Diagnosis sounds like it could overlap with blackleg.
It can. So lab confirmation is more important here, FA staining, PCR, anaerobic culture. And you need to get samples fast after death because C. septicum is a notorious postmortem invader and can overgrow, confusing the picture.
Treatment challenges again.
Often unrewarding, yes. High-dose penicillin or broad-spectrum antibiotics, anti-inflammatories, IV fluids might be tried. Sometimes surgically opening the swelling for drainage is attempted.
Prevention strategies, similar to blackleg.
Similar, yes. Multivalent Clostridial vaccines that include C. septicum are key. The 2-dose initial series, annual boosters, especially before procedures likely to cause wounds, and meticulous hygiene during any invasive procedure, clean instruments are vital. Plus, proper carcass disposal.
Now, black disease, infectious necrotic hepatitis, Clostridium noviae type B, this one has a really interesting connection to another parasite, right? It's not just the bacteria acting alone.
You got it. Black disease is strongly linked to liver fluke migration, the parasite Fasciola hepatica.
How does that work?
So the animal ingests C. novi spores that go to the liver and lie dormant. The liver fluke larvae then migrate through the liver tissue as part of their life cycle. That migration causes damage.
Creating those anaerobic conditions the spores need.
Exactly. The fluke damage creates little pockets of dead, low-oxygen tissue, perfect for the dormant C. novi spores to germinate. They multiply, produce toxins.
Leading to liver damage.
Severe liver necrosis, yes. And capillary damage, which leads to that characteristic dark, blackish discoloration under the skin, hence the name black disease. It often occurs seasonally, tied to when liver fluke activity is highest.
A deadly partnership between parasite and bacteria. What are the signs?
Again, often sudden death in apparently healthy animals. If signs are seen, it's usually severe depression, reluctance to move, maybe absent rumen sounds, muffled heart sounds, sometimes a low body temperature. Death typically within 48 hours.
Diagnosis, necropsy findings.
You'd suspect it in cases of sudden death, especially in areas known for liver fluke. Necropsy might show frothy blood from the nostrils, that dark subcutaneous tissue, a swollen liver with obvious areas of necrosis, and blood-stained fluid in the body cavities. Lab confirmation involved culturing C. novii from the liver lesion.
Treatment likely futile.
Rarely successful due to the rapid onset.
So prevention has to target both the bacteria and the fluke.
Absolutely critical. You need multivalent Clostridial vaccines, including C. novii, timed appropriately before the fluke season. And equally important is strategic liver fluke control, regular deworming with effective flukicides, plus pasture management to reduce the snail intermediate host population.
Okay, similar theme with bacillary hemoglobinuria or red water disease. Clostridium hemolyticum, sometimes called C. novii type D, also linked to liver flukes.
Yes, another one strongly associated with liver fluke damage, creating those anaerobic conditions in the liver for spore germination.
But the toxin and effect are different from black disease.
Right. Here, the key toxin is beta toxin. Its main action is causing massive intravascular hemolysis destruction of red blood cells right within the blood vessels, as well as liver necrosis.
Hemolysis, red blood cell destruction. That explains the red water name.
Precisely. The breakdown products of all those destroyed red blood cells spill into the urine, making it dark red or port wine colored. That's hemoglobinuria.
What are the other signs?
Acute onset, often sudden death, if seen alive. High fever, depression, that characteristic red urine, often jaundice, yellowing of mucous membranes from the liver damage and hemolysis, and pale membranes due to the anemia. Again, rapid progression, death usually in 12-48 hours.
Diagnosis based on that red urine and fluke history.
Primarily, yes. Sudden death with hemoglobinuria in a fluke area points strongly towards it.
Yeah.
Necropsy shows those liver infarcts, areas of necrosis, jaundice, and the dark red urine in the bladder. Lab confirmation uses FA staining of liver tissue.
Treatment prognosis.
Poor, due to the rapid onset. Penicillin might be tried if caught extremely early.
And prevention, again, is two-pronged.
Exactly. Vaccination with multivalent vaccines, including C. hemolyticum, and aggressive liver fluke control through regular treatment and pasture management. You have to break that cycle.
Okay, our final category, the enterotoxic clostridiosis hitting the gut. The main player here is enterotoxemia, often called overeating disease, caused by Clostridium perfringens. Now, you said C. perfringens is a normal gut resident. How does it turn bad?
That's the crucial point. It is normal, but specific conditions allow it to overgrow rapidly, explosively.
Like what kind of conditions?
Sudden changes in diet are a big one, especially switching to high carbohydrate or high protein feeds. Overfeeding in general. Anything that disrupts the normal gut environment or slows down gut motility.
So it sounds very much like a management-induced risk, maybe linked to intensive feeding.
That's a very good way to put it. These bacteria absolutely thrive on readily available starches and sugars in the small intestine. So yeah, modern feeding practices, high-energy rations, abrupt feed changes can unfortunately create the perfect storm for C. perfringens to proliferate.
And once they overgrow, they produce toxins.
Right. Potent exotoxins, different types, like alpha, beta, epsilon, iota, depending on the specific strain or type of C. perfringens. These toxins damage the intestinal lining, cause hemorrhage, necrosis, absorb systemically, causing toxemia, shock, and death.
You mentioned different types, A, B, C, D, E. Do they cause different problems?
They do, yes, based largely on the toxins they produce.
Can you give some examples?
Sure. Type A is sometimes linked to jejunal hemorrhage syndrome in adult cattle, sudden death, colic. Also, abomasal inflammation in young calves, maybe 2 to 4 weeks old.
Okay. What about types B and C?
Types B and C cause really severe hemorrhagic enteritis, mainly in very young calves, less than 2 weeks old. Bloody diarrhea, sudden death.
And there's something specific about why young calves are susceptible to the beta toxin from these types.
Yes, it's quite interesting. Beta toxin is normally destroyed by trypsin, a digestive enzyme. But newborn calves have trypsin inhibitors naturally present in their colostrum and early milk. This helps them absorb antibodies, but it also protects the beta toxin from being broken down.
Ah, so the calf's own protective mechanism inadvertently helps the toxin. Clever in a nasty way.
It is. Then you have type D, famously known as pulpy kidney disease.
Pulpy kidney.
Yeah. It typically affects young, fast-growing animals, often lambs but also calves, on high carbohydrate diets. They often show neurological signs like throwing their head back, convulsions before sudden death. The kidneys decompose very rapidly after death, becoming soft and pulpy, hence the name.
So what are the general clinical signs a producer might see across these types, assuming it's not just sudden death?
Well, sudden death is very frequent. If signs are seen, it's often depression, severe abdominal pain, bloating, diarrhea, which might be watery, bloody, or contain mucus, progressing quickly to shock, maybe convulsions.
Diagnosis sounds tricky if the bacteria is normally there anyway.
Exactly. Just finding C. perfringens in a gut sample doesn't prove it caused the disease. You need to correlate it with the clinical signs, the specific lesions seen at necropsy, and ideally actually detect the toxins in the intestinal contents or feces. Toxin detection is key.
And treatment. Often too late again.
Often unsuccessful, yes, because of the rapid onset and the potent toxins already doing damage. Antibiotics like penicillin might help if caught very early, but they don't neutralize the preformed toxins.
Is there an antitoxin?
Yes, there is C. Perfringens antitoxin, specifically for types C and D, neutralizing beta and epsilon toxins mainly. It can be very helpful if given early, alongside supportive care like fluids and anti-inflammatories.
But prevention is clearly where the focus needs to be. What's the strategy for enterotoxemia?
It's multifaceted. First, minimize exposure. Meticulous sanitation in calving areas is important to reduce spore load. Second, enhance immunity. Colostrum is absolutely vital for passive protection in calves.
And vaccinating the mother helps with that.
Yes, vaccinating the dam before calving, often part of scour vaccine protocols, boosts antibody levels in her colostrum, giving the calf better protection. You can also give injectable antitoxin to high-risk calves right at birth for immediate short-term protection.
And the feeding management side.
Critically important. Strict adherence to feeding protocols. Avoid sudden changes in diet, especially introducing high-energy feeds too quickly. Make sure milk replacer is mixed correctly, fed at the right temperature on a consistent schedule. Avoid overcrowding where calves might gorge. gradual feed transitions are essential.
Okay, zooming out again, thinking about the overall economic impact of all these clostridial diseases, it sounds like a major drain on the industry.
It really is a significant global economic burden. Because they're so rapid and fatal, the main costs are direct animal mortality, losing valuable animals, and the costs of prevention, rather than long treatment bills.
So high death loss, maybe reduced productivity in any rare survivors, treatment costs even if they don't work.
Exactly. And the ongoing cost of vaccination programs, biosecurity measures. The source material mentioned a specific example from Brazil. A botulism outbreak cost around USD 10,000 from just 25 deaths in one feedlot.
That adds up fast.
It does. So the core economic message is pretty clear. Investing strategically in robust prevention, especially comprehensive vaccination, gives a much better return than trying to reactively treat these diseases. It's really an investment, not just an expense.
Given the challenges, the speed, the silent nature, how do vets approach diagnoses in general? Catching the uncatchable, so to speak.
Yeah, it demands a sort of multimodal approach. You need to gather clues from different angles.
Like what?
Microscopic examination can be quick and helpful things like that fluorescent antibody, FA, staining for blackleg or malignant edema. Bacterial culture is the gold standard for identifying many bacteria, but for Clostridia, you need fresh samples quickly because of those postmortem invaders. Molecular methods like PCR are very sensitive too.
But often, necropsy is the key.
Often crucial and definitive, yes, especially because of the rapid death.
Yeah.
The specific lesions tell a big story. Blackleg's dark, gassy muscle, malignant edemas, pitting swellings, black diseases, liver necrosis, and dark tissues, redwater's liver infarcts and red urine, enterotoxemia's gut hemorrhage or inflammation. But not for tetanus and botulism.
Correct. For those two, there are no specific gross lesions at necropsy. Diagnosis hinges heavily on the clinical signs observed before death and the history. It really is like putting together a puzzle.
And general treatment principles, we've touched on this, but what's the overall picture acknowledging the limitations?
Overall, treatment is tough, often unrewarding, simply because things move too fast. Death often occurs before intervention is possible or effective.
Antibiotics like penicillin.
Many Clostridia are sensitive, yes, but their effectiveness is really limited by the rapid disease course, especially when the damage is already done by toxins, like in tetanus or advanced enterotoxemia.
Antitoxins.
They provide passive immunity, neutralizing circulating toxin, crucial for tetanus if given super early, and helpful for C. perfringens types, C and D enterotoxemia, but generally not an option for botulism in cattle.
So supportive care is often the main or only option. It's a critical component if there's any chance. Fluids, pain relief, muscle relaxants where appropriate, good nursing care, low-stress environment. For something like botulism, it is often the only thing you can do. But the big challenge remains that peracute nature. Animals die without time to react.
Which brings us full circle back to prevention, that integrated shield. What are the absolute core elements?
Given everything we've discussed, prevention is paramount, way more effective than treatment. And it needs that integrated approach.
Starting with vaccination.
Absolutely. Robust vaccination programs, those multivalent 7-way or 8-way vaccines give broad protection. They're safe, reliable, and generally very cost-effective. You mentioned about $1.70 a dose earlier, though labor adds to that, of course.
And the schedule?
Typically the 2 initial doses, 3-6 weeks apart, then annual boosters. Oftentimes before calving for that maternal antibody boost, calves usually start around 2-3 months. And definitely vaccinating before planned surgeries or after major trauma is smart.
Beyond vaccines, what about biosecurity, day-to-day farm hygiene?
Hugely important. Meticulous cleaning and disinfection of calving areas, pens, high traffic spots, proper manure management, disinfecting surgical instruments thoroughly between animals, castration knives, dehorners, changing needles frequently, maybe every 10 animals or even every single animal for certain procedures.
And controlling animal movement.
Ideally, limit new introductions.
Yeah.
If you do bring animals in, isolate and maybe test them first. A closed herd is the best biosecurity you can have against many things, including Clostridials.
What about herd management practices that reduce underlying risk?
Nutrition is key. Balanced diets support immunity. And specifically for enterotoxemia, those careful feed transitions, avoiding sudden high-carb loads, addressing mineral deficiencies like phosphorus to prevent bone chewing linked to botulism.
Stress reduction.
Yes, minimizing stress from transport, handling, overcrowding, heat. Stress lowers immunity and can even trigger dormant spores like we discussed with blackleg.
And carcass disposal, you've mentioned it a few times, sounds critical.
Paramount. To stop environmental contamination with those persistent spores, incineration is best, deep burial is acceptable. But crucially, plug all the natural openings, nose, mouth, anus, before moving a carcass to prevent spores leaking out. And don't use lime on contaminated ground. It doesn't kill spores as effectively. Use appropriate disinfectants like formalin or bleach cautiously.
And finally, proactive wound management seems especially vital for things like tetanus and malignant edema.
Absolutely. Prompt, thorough cleaning, debridement, proper care for any wound minimizes the risk of those anaerobic conditions forming. And for high-risk procedures like banding for castration, tetanus prophylaxis toxoid or antitoxin is highly recommended.
So our deep dive today really paints a clear picture, doesn't it? These clostridial diseases, with their speed, their silence, their often fatal nature, by the time you see a sign, it's usually way too late.
It fundamentally shifts the whole game, from reaction to proaction. Prevention isn't just ideal, it's basically the only viable strategy.
Remember that integrated shield we talked about?
Right.
Robust, tailored vaccination?
Meticulous biosecurity in everything you do.
Sound herd management, nutrition, stress reduction.
Vigilant wound care, proper carcass disposal. These aren't just nice-to-haves. They're the most effective defense, economically and for animal welfare, against these really devastating pathogens.
We've seen just how pervasive these Clostridium spores are, literally everywhere in the environment under our feet. So here's a thought to leave you with. What does it truly mean for animal health, maybe even for all life, that such potent, silent threats are just part of the ecosystem?
And as we face changing climates, changing agricultural practices, how might the dynamics of these ubiquitous pathogens evolve? Will risks shift? What new tools or strategies might we need to stay ahead of an enemy that's always there, just waiting for its chance?
We hope this deep dive leaves you not just informed, but with a maybe deeper appreciation for that complex dance between animal health, the environment, and our own management practices, and perhaps a few new questions to chew on.